Bismillahirrahmanirrahim. Welcome back to Daniyal Ultrasound Clinic, Dr. Munir Abbasi. Today we have got a pelvic pathology, very interesting case. And on ultrasound scan, here is the right ovary. It appears enlarged with thickened outline. But the most important thing is here to note is that it is enlarged and shows a well-defined complex. It appears like a well-defined complex mass lesion and measuring approximately 3.4 into 4 centimeters, and the consistency is showing mixed echogenicity. This lesion contains actually both echogenic and hypoechoic areas with the internal echoes, and sometimes there are also shadowings here. You can see this. Here is the real time which shows few shadows which are emitting from some echogenic areas. Like I will tell you later what they are. So the lesion contains both echogenic and hypoechogenic areas with the internal echoes, and sometimes showing shadowings like they are from fate, hair, or calcifications. These are not calculi, these are calcifications. So these features are typical of the dermoid cyst. Dermoid cyst or cystic teratoma. Here the features are typical of the dermoid cyst and a mature cystic teratoma. I am magnifying it. Here you see echogenic area in the areas in the center surrounded by the thick hypoechogenic outline, also shadows which are arising from the echogenic areas, and here we have no solid content. Now let's go to this is typical of the dermoid cyst. Now let's go to the uterus. At a time there are many findings. Here on transverse section of uterus we see two cavities extending from the right to the left, and when we go down they both join each other. So this is a bicarnate uterus showing structural defect as well. But another thing to note on longitudinal section here is, it's very important thing. You see what we see in the cavity, let's note it. The uterus shows a thickened endometrial cavity. This is suggestive of the endometrial hyperplasia, which may occur due to actually hormonal imbalances, and endometrial thickness should always be considered with the patient's age. Tanju mere ghani hai beta? She is 22 years old, unmarried lady, unmarried and 22 years old. She is a menstruating woman, and actually she came with the complaint of pain in the loins. So let's measure the endometrial cavity and longitudinal section from anterior to posterior area. It's 1.6 centimeters, and the single layer measurement is 0.6 centimeters. So this is a thickened hyperechogenic cavity showing central hypoechogenic area. This is typical of endometrial hyperplasia. It isn't a polyp, because in polyp the endometrial cavity appears homogeneously echogenic or hyperechogenic. So there is a central hypoechogenic area which shows the layer of the endometrial cavity. The cervix is also enlarged. So we are watching here the dermoid cyst, endometrial hyperplasia with enlarged uterus, And another finding is here. It's a very typical and interesting case. Here is the left ovary. What do you see in the left ovary? The left ovary appears enlarged and showing a cystic structure which contains internal debris like echoes and strands of fibrin. So the interpretation is here, there is also a thin hypoechogenic area around the ovary. The interpretation would be left ovarian cyst measuring approximately 4.3 into 4 centimeters, showing the features of ovulation and forming a corpus luteum cyst. So nothing to worry about this thing, at least. Most of the gynecologists or the sonologists, they misinterpret these things and they just write down hemorrhagic cyst or something like that, then patient has to undergo unnecessary operation. So this, we should refrain from this practice and go through in depth all these structures so our patient shouldn't suffer from unnecessary burden of financial crisis or other health issues. So this is corpus luteum cyst in the left ovary. Here is the dermoid cyst in the right ovary. Here is in transverse section, uterus has got endometrial cavity, hyperplasia, as well as the bicarbonate uterus. So this is all from my side. Thank you very much.